Welcome to the AgEmerge Podcast, brought to you by Ag Solutions Network. Your farming challenges are unique, so your practices should be too. We're here to share emerging ideas, build connections, and provoke conversation.
Get ready to improve your soil, your crops, your livestock, and your family's livelihood. I'm your producer, Kim Chase.
And I'm your host, Monty Bottens. Thanks for joining us.
Welcome to today's episode. If your passion lies at the crossroads of food, human health, and soil health, you are in for a great listen. Our guests are Jimmy Emmons, Senior Vice President of Climate Smart Programs at Trust in Food, and Erin Martin, President of the Tulsa Urban Ag Coalition, Director of FreshRx Oklahoma, and co-lead of Oklahoma's Food is Medicine Policy Coalition. They're not just talking about change, they are leading it. From regenerating soils to cultivating nutritious food and promoting human health, these two are at the forefront of a movement that's turning vision into reality. So get ready to be inspired as we dive into this conversation that's reshaping our food and soil systems. Let's get started.
Well, welcome everyone to this episode of the AgEmerge Podcast. I'm joined today by repeat offenders, known as Jake and Elwood Blues, or otherwise Jimmy Emmons and Erin Martin. Welcome, guys.
Thanks, Monty.
So
Thanks a lot, Monty.
They're part of the Black Hat Mafia, so they got their cowboy hats on. But Jimmy didn't get the note; he's got his palm hat on. But that's okay. It's summer. It's air conditioned. That's always a good thing. Well, you guys wanted to get together and visit about some exciting things, so get us up to speed, and maybe if you would individually tell us a little bit about your stories in case people haven't heard it before on previous episodes. Just give us a little bit of your story and bring us up to speed to today. Erin, we'll start with you.
All right. Well, hi, everyone. Do you remember what our episode before was called, Monty? So if people want to go back and look, I don't recall.
What we'll do is we'll put the episode in the notes because I don't remember it off the top of my head either.
Okay.
But if you search for, your name in there, it'll certainly poke up. But we were talking about what you were doing with food and connecting urban and all of the dietary type of things to help prevent type 2 diabetes and your program there in, I believe, FreshRx in Oklahoma or in Tulsa there that you're working with.
Yeah, so if you all are interested in learning more, please dive in. We'll talk about it here on this episode as well, but certainly search Erin Martin with AgEmerge and you'll see our previous episode and we'll put a link there. My story is not from agriculture, but has led to me being very deeply involved with agriculture. My background's in long-term care and seeing people, what it looks like after a lifetime of poor health and poor nutrition and what that looks like at the very end. And it's not pretty, folks, especially in certain areas of the world. In the United States, which is one of the wealthiest countries or is the wealthiest country in the world, we have some of the poorest health outcomes, which are really attributed to our food system. And so connecting the dots of food as medicine, regenerative agriculture, I've been able to produce a program where doctors prescribe locally grown fruits and vegetables, and it's grown rapidly, and I've been able to advocate for policy and speak all over the country and speak with Jimmy Emmons, and we've partnered in many ways, so we're really excited to be here today.
And take a listen to that previous podcast because they've had just some amazing results in type 2 diabetes high figures of success of lowering their A1C and improving their outcomes for their life. So it can be done with food instead of Ozempic. See, it's amazing. Jimmy, welcome back, sir. Another repeat offender. Tell us, everybody will recognize you by your voice, I'm sure, but tell us a little bit of your background and what brings you here today.
Well, thanks, Monty. I'm glad to be back, and I'm especially happy to be here with Erin today. So Jimmy Emmons here in Northwest Oklahoma. I farm and ranch out here in a semi-arid environment in Western Oklahoma. I also work at Farm Journal and Trust in Food Division and do a lot of conservation practices on the ground with incentives for farmers and ranchers across the country. So I'm happy to be here today. and really happy to have been working with Erin for quite some time now on her FreshRx program and trying to help her and her colleagues and all the patients and growers as well. So we'll talk more about that as we go, Monty.
Well, both of you travel the world and talk on your topic, and we do want to know, when do you sleep? Is there time for that in your guys' schedules?
Yeah,
Well,
8 to 10 hours a night.
Oh, there you go. See, I love it. See, right answer. See, Jimmy, that's what we're doing wrong.
I guess I must have a guiltier conscience or something because I can't seem to get that much here lately. So
We
So,
just work really efficiently, Monty, and we time travel. Regenerative agriculture has given us these special powers. Mother Earth has decided that we just have to move a lot quicker.
that comes in handy. There you go. So recently, had a chance to testify before Congress, correct?
Yes, I got to testify before Congress. It was rescheduled when they tried to impeach a senator. So I was on my way to the airport and they called and said, well, we're going to have to reschedule this. But luckily they did reschedule it. And so it was a couple months ago, got to testify before Congress. It was a committee on the Older Americans Act. It's a subcommittee of the Older Americans Act. And for a lot of people that don't know what that is a fund that funds every county across the United States for congregate meal programs, rural health clinics, federally qualified health clinics. They fund a lot of Meals on Wheels programs. And so our recommendation was, hey, why don't you enhance these programs that are already providing food and actually see what kind of health outcomes you could get by enhancing the programs and making them more standard food as medicine programs and interventions. And it was a really enlightening experience. It was very clear that this is a bipartisan issue, that everybody knows someone who's sick. Everybody cares about their family and friends who are sick, and everyone wants to feel well as well. So it was really great to see that across both sides of the aisle, everybody agrees that this should be federalized and there should be federal funding. And we're hopeful within the next 5 years that's going to really take flight.
So you're looking at the money that's currently being spent with a food distributor or something like that, do something to where you can reach out to a little more local or regeneratively raised food to provide within that senior channel, if you will. And then also, a lot of things are already in place there, right? So it's not like you have to invent
Right.
A new system.
Right. And there's definitely lots of different ways of distributing food or getting people access to food as medicine programs. But I did talk specifically about the local aspect, the food is more fresh, supporting local economies and how that has the potential to resurrect rural America in many ways. And that there's just huge value in that. And if we're giving people food that is, at best depleted of nutrients, at worst really exacerbating chronic conditions, then why don't we just use the same money and the same pathways to enhance those outcomes and actually save us money in healthcare cost savings? And so it seems like people really agree with that. I think people even on both sides of the aisle like the fact of reinvesting in local farming work and connecting that to people in the community that need it to improve their health. So they actually took a lot of our suggestions. The Older Americans Act, kind of like the Farm Bill, is renewed every so many years. And they actually took our suggestions and put them into some legislation that's been suggested to the Older Americans Act. So fingers crossed, we're really hopeful that some funding pathway goes through there. We've also helped get some appropriations through Veteran Affairs, because we've even thought with our local VA, wouldn't it be great if like veterans could grow food for other veterans experiencing these health challenges? And then there's been appropriations through Indian Health Services. So they're all kind of doing these demonstration type programs, and hopefully that will result in permanent policy change.
Yeah, it's coming from a lot of different angles, isn't it? Because I remember visiting
Right.
with Tom Cotter, and that's happening up there with the Minnesota National Guard, like you mentioned, and also with the Indian Affairs.
Yep.
Those things are happening, and I know in Illinois, and maybe this is in every state, but there's specific grants out there that go to schools, and you can have even our little small school of Cambridge, has 50 students a year that graduate. They have $4,000 they can go out and spend and buy food from local farmers.
Right, right.
So there's multiple kind of trials going on in this.
Right. Yeah. And I think in the food as medicine space, we're just throwing stuff at the dart. I mean, at the map with the dart, just trying to see like what sticks. And yes, the farm to school grants have been really cool. I think what they didn't really do was, these administrators have never sourced local food before. And so there really needed to kind of be an intermediary to kind of like facilitate some of that purchasing. Some had great success, some had other challenges. We also saw the local food procurement through the food banks and other tribes. And there's been, there's challenges with new programs all the time. So there's definitely ways to improve them, but they were really beneficial to give farmers, like if they had leftover food, that they could actually sell it someplace and sell it locally that would go to their local community. And so, yes, there's just all these different avenues, and hoping that that just continues to diversify because there's plenty of people to serve.
Jimmy, and all the work that you're doing connecting with different people. I mean, you see the food is medicine, and for children, and for older adults, and that. What does this tell you about what's going on out there? What do you think is at the base of this? Isn't there something to do with what the consumer, and they trust the farmer, right? But getting that food to them, there's becoming this kind of disparity in trust because of this unknown quality. Is that fair to say?
Yeah, it is. And, as bad as COVID was for our country as a whole, it really brought awareness of what fresh local food could do. And because our country has been on this right now time frame that in manufacturing and food and all was just in time when it got delivered. And so when that disruption came, and it looked like a big disruption, but it really in world matters, it was just a small disruption, but it turned into a big disruption of our food distribution across the country. And so consumers said, well, the way to fix that is let's look locally. And then became the challenges of where do I find it? Just like Erin was talking about, all these schools that got in here in Oklahoma, we had that same issue. I was getting calls like, where do we find local food at? We have no idea. So great programs that come along from USDA and federal government programs sometimes lack some of that, and I'm going to call it out, common sense, that a little bit more common sense applied to that would have had connecting rods to local sources out there like Erin was talking about. And that's kind of what makes Erin and I the dynamic duo, so to speak, because you can see her passion in her program that she's facilitated, and I have the passion to try to help regulations and processes that we have in the country to change to make it easier for growers to get hoop houses through federal programs. And we've experienced some of them issues in the program here in Tulsa, which I was able to help alleviate some of that pressure and got some through. And it was just lack of the local offices understanding the rule changes and awareness, and getting state leaders to push that out. And so that's the reason I just got on the Federal Advisory Committee for Urban Agriculture as well, to try to facilitate a little of that common sense interjection into some of this, because we see a great need for fresh food in health. And Erin and Dr. Ferris, you've really proven that over there in Tulsa. And Erin is getting calls, weekly, every few weeks, of other states and other parts of the country wanting, to expand and grow it and get this out. So we see a great need and urgency to try to improve this as we go. So that's kind of where I come in, trying to assist growers in urban agriculture, and even bigger growers can do this, but they got to get out of their box a little bit to think about growing vegetables and picking them and having help to get them in there. So, I think there's worlds of opportunity. And I knew that from the first time that I met Erin, that I could see her passion oozing out to grow this program and to really help it. And then once I met Dr. Farish and saw his passion and how he's actually seeing dramatic changes, then it just really energized me and others to try to help and facilitate. So, I just try to help Erin spread the word and then try to help facilitate a little bit of my USDA background that can help in certain areas.
Well,
And when Jimmy helped out with just helping farmers grow and diversify and increase their economic, diversifying their economic markets by selling to a food as medicine program, but also just strengthening their operations, it just took Jimmy common sense. Like, he picked up the phone, he made the proper phone calls, and he got the job done. And unfortunately, there's not a Jimmy in every single state. There's not an Erin Martin in every. We're trying to figure out a way to clone ourselves. We're working on that in the laboratory, but in the meantime, we really have to have these pathways and make sure that this is models of maybe even behavior of common sense that can be replicated, and for people to really understand that. So meeting Jimmy and us being able to be like, oh, we have common sense, we're willing to just pick up the phone and do what's needed to get done, and really understand the overarching point of what we're trying to accomplish and just do what needs to happen. We've become very productive together, and it's great to also meet other people like that. And so people like that, getting more of those folks together is going to be super important to kind of open the pathways. And there's so many, just like Jimmy was talking about.
Well, I've been a little leery of lab-grown meat, but I got to admit, I'd be very leery of lab-grown Jimmy Emmons.
I'd be leery of it
I have
myself.
to draw the line somewhere. And Erin, a few more of you, that's fine, but one of
Maybe
Jimmy's
not
enough,
Jimmy.
don't you think? No, I
That's not
agree.
the
You
first
you
time I
guys
heard
do
that
need to
line.
have mini me's. So
Yeah, the government might actually have to do their job and use common sense if there were more Jimmys.
exactly.
The AgEmerge Podcast is brought to you by Ag Solutions Network. The ASN team is hands-on, digging in and invested in regenerative agriculture. Along with the proper plant nutrition and biologicals to boost your soil microbiome, we provide the ideas and implementation guidance to support you on your soil health journey. So stop farming the same way and contact Ag Solutions Network today at asn.farm.
So I want to just back up a minute and talk to me about, if you think about the trillions upon trillions of dollars that have been invested into the food healthcare continuum, okay, over since World War II, not just public money, but the private money. There are countless trillions, probably even approaching a quadrillion of funding that's been put into assets, production models, marketing, branding, all this, everything to get to where we are today with food and medicine. There is a lot of incentive to not change. And also there's a mentality, right? How do you break through that mentality of the consumer and the bureaucrat to help them understand that what we've done and how we've invested in what we've done for 70 years isn't the right thing to do? How do you do that?
Jimmy, you
That's
go first.
that's a huge obstacle. And Monty, it's much like trying to get producers to change what they've always done as well. And even when we were talking with Dr. Farish, and I remember Rick Clark asking, Dr. Ferris, well, how come every doctor's not jumping at this? Well, it's the same story. They have been taught in chemical medicine and to pull a blood sample and make a chemical recommendation. And the system is set up that way and they get reimbursed that way. So the whole system literally is on the easy button, and the easy button is not the correct button. Uh, and to change that is like trying to dodge an iceberg with the Titanic at the last minute. It takes a lot of maneuvering to get a big ship to lean to the right a little bit or lean to the left to get around the obstacle. But it can be done. I mean, it takes proactive people with a good sound message to legislators, just like Erin was doing, and like I've talked to leaders before, with a little common sense. A lot of these people have common sense, but what really happens when you write legislation as a legislator and you get it officially signed at House and Senate, then it goes over to the rule makers and the budget people, and then they interpret that law and write rules for
And the
it.
devil's in the details.
That's the number one culprit to start with. And America is really good at interpretations. Uh, how you interpret a law and how each word is so critical. But that's where the problem starts, and it goes off, because I've worked with legislators before in farm programs and said, did you intend for this program that you helped write be written this way? It's like, no, 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 no. That's not how we done that. And well, this is the rule. Well, it's incorrect. And then it takes 3 or 4 years to get that corrected. So there's lots of issues like this that is hard to address. But if we don't ever start, we never will get it done. And that's what Erin and I are trying to do, is interject and try to change this system that's off in left field, where we don't need it. We need to get it back to the center, and start down that road of regenerative ag and let fresh local food at the right place in the right time as well. So it's a major problem, and most common problems is people don't think their voice matters in DC or the state house, either one. In truth and reality, if you go see them and you talk to them one on one or write them a letter, they do care, and they will listen, and it will make a difference. You got to have a force with you. It can't just be one idea, but if you have a good message and a good team, they will listen, and we can start that. And Erin and I've been working on that. That's the reason she got to testify before Congress about the issues, and we're seeing that the need and the want to is there to change this and try to fix that. It's just not an overnight express deal. It takes a while to do it, but we're dedicated and serious about trying to make it happen.
Yeah, and the thirst is there, and that's what's become like so clear, that we have seen this all over the country. There is not a group, I think Jimmy and I have talked to, whether could be directly connected or not, that didn't have, I mean, anyone on the street, really people want to be healthy. The problem is, and people want to have local food. I mean, that's something I think everybody agrees on. The problem is that there's not a convenient way to do it, that everything else has been built differently and with different intentions, and there's not a clear pathway, and there's not a convenient way to do it. And kind of like Jimmy was talking about the ship turning, there's a book I read in a leadership course called The Bull and the Rider, and you can start by changing the rider's mind, but then he's got to turn that bull, and that's going to take a lot of work, and it takes a lot of time. So it's patience, it's building relationships, it's speaking up, it's speaking common sense to people, speaking to their hearts, to their general understanding. People want it to be different. People know, and also having the data to back it up. Like when I tell somebody our greatest weight loss was 116 pounds, she came off of all her medications like in 8 months in our program. I think about 5 years ago, it just people weren't as open, but it has really evolved for people are more open-minded. There's American lifestyle medicine, so doctors treating patients with lifestyle change. Like there's all these different shifts that have happened, I think, in the last 5 to 10 years that kind of have opened up the floodgates for this. And so everybody's ready and the thirst is there. And even in like a small town, I was speaking in Hoxie, Kansas, a town of little under 2,000 people, and the hospital had already done a food as medicine program with 16 patients and had data to prove it. And it just takes, even if it's tiny like that, it just takes that. And then there's all this ripple effect from that. And we ate at a restaurant in this tiny town where they source 70% of their food from local growers. And so this is everywhere. This isn't just urban cities. This is in tiny rural towns. People want this. They know healthcare is not working. It's sick care. It's not healthcare. They know farmers are struggling. They know the system in which the farmers have to engage in are not helping them. We know the food we're not really growing food. We're growing corn for other purposes and for feed, but also for ethanol production and shipping it out of this country. We all know we have these food desert issues, and all this is like coming to the head. And so it just takes people to speak up, to be persistent, to be focused and organized, and to continue chipping away and eating the elephant one bite at a time. And if you just keep going, it will feel like pushing a boulder up a hill, but you will eventually get it up there and you'll have more people helping you push it along the way. But if you just let go, it'll roll back down. And so it does take persistence. The passion certainly helps. And so just letting that out and being able to communicate with people and just being willing to stand up and to speak truth, but also be I think finding middle ground with people, like there's certainly hot divisive issues. Just stay focused on what you're working on, which is we want farmers to succeed. We want people to be healthy, and everybody agrees.
Mm-hmm. Let me ask you this. Is there anyone, and maybe you are at the center of this, Erin, that has looked at maybe a meta study or a collection of these different data sets that are being accumulated? So you've got what you've done at FreshRx in Tulsa. You've got this example that you just mentioned from Hoxie, Kansas, a huge metropolis. You also have the doctor that was on our episode. Name's slipping me right now, but from Alameda County, California, where he's working a food as medicine prescription program. And there's several of these little pockets that have had great results. Has anyone put all this together as like a metadata study?
So there is more and more data coming out. And as far as kind of putting all that together, what's really exciting is that the Tufts University in Boston, they opened a food as medicine policy institute just a little under 2 years ago. And I'll share generally, but they have really seen the push and they have highlighted the importance of local food procurement for food as medicine programs. And they've looked at programs like, I'm guessing you're talking about Dr. Stephen Chin from Alameda. Yes, my comrade. So we found each other at a USDA conference, and I went, and he was touting regenerative agriculture and just so shocked, like still no one's talking about that or talking about how food is sourced, but they're so passionate about food as medicine. There's this like synapse in the brain that has been destroyed, I guess, in certain people. And so I just went up to him and I said, guess what? I'm only sourcing regenerative food as well. And it was just like he had someone to finally echo him. And so now we're echoing each other, and we have found that we have found others that are echoing us. And there's a small group of us, but we are looking at doing a study together, looking at our program, specifically ones that number one, source local, and then number two, source regeneratively, and measuring the impacts on what that is and why people should do this. And there may be added benefit to sourcing local that we don't even know yet, that we'll be able to collect data on and present that. So cross your fingers for us. We have to apply for funding for this, so we're really hopeful. And so that's being looked at. And then, of course, there's lots of other programs that are starting to announce research. And there's a woman named Mary Purdy who actually collects all that food as medicine data. She has it on her website, and there's several kind of advocates that kind of actively do that and send out information. Harvard University, in their law department, they focus on health and law policy, and so they're a huge source of information. So there are people doing that, and that's what we told the federal government. As you all have these funding pathways and you support these programs, these small nonprofits that have been doing this hard work for so long, they don't have the capacity to do these in-depth studies. So if the federal government and healthcare, if they start funding this, then we will be able to look at stuff deeper and have more rigorous studies done. And so that's what we really need.
Excellent. Glad to hear that. And it's good to see that there's a movement, right? A mass of it coming on, and it's a true entrepreneurial spirit. There's little different nuances to each one of these models in different locations that we'll be able to, extract information out. My personal opinion is that it all has to do with the microbiome. So when you grow food regeneratively, it has a different microbiome or microbial life within the food itself. And then when you have it fresh, that microbiome is still alive and has that diversity. So that distance and key from time that you pick it to eat it is really critical. So those two things coming together, the diversity of that of the biology of that plant or animal that you're eating is critical. So how do we get then? We've got Erin creating the itch, Jimmy, that we need to do things better with better food. How are we going to supply the scratch? How are we going to get farmers to I'll be dead honest with you, okay? Regenerative farming is not easy. It is not management easy. It is not labor easy. It is harder today, okay? Today, it is harder than conventional, You can't just wait until a windy day to go out and spray your enlist and drift onto your neighbors and who cares, and kill any weed that you want, like you can in a conventional program. How do we help farmers invest that extra management and learn those skills and invest that extra effort to raise this more nutrient dense food and get it to how do we overcome that portion of this huge challenge you two are up to?
That's the second huge challenge that we have, and that's what I was talking about a while ago. Getting them to understand. We've had farmers come to us that's had family members sick that now get what it takes to do that. But for the average Joe out there, that's, like I said, on the easy button, them are hard to change. But in these tough economic times, and ag is really in a pinch now, if you look at numbers, typically that drives people to look at different ways to cut back, to be regenerative, and to, because they're trying to cut inputs, they're trying to cut costs back, and they're willing to go the extra mile. Like I said, I was just at a conference this morning, and one of the researchers was saying exactly what you said. This is harder. There's more hours involved in it. Well, I can debate both sides of that, because I think it's become easier for me. I spend less hours on the tractor tilling and working. I've cut my equipment down to 2 or 3 pieces of equipment versus where I had 10 or 12 before. I think there's a lot of ways that we can look at this differently, but it's hard to do. It's very hard, and it's a big challenge. But I think, and Erin's getting close to year 3 now, with Dr. Farish and them up there, and as well as I do, Monty, that it takes at least 3 years of data to write a paper that can be hold up against vigorous criticism. The longer we get that data that proves what she's doing there, and as we gather all the other data from all these smaller pods, as you said, across the country, you start telling a compelling story. And then we have the farmers now that are starting to be more profitable per acre, and not focused on yield. And that's one thing that FreshRx does to these smaller farmers. It gives them a steady income and market, because they know how much they got to grow, what they got to grow every week for the needs of the boxes that goes out. So it's a steady market. It's not like going to a farmer's market and sell what you can sell, and then have leftovers. So it gives them a steady revenue stream, and consistently. That means a lot to a small grower. And even if Jimmy put in hoop houses and added his bigger operation, it brings a lot to the table in a small area. So I think it's just telling that story and sharing the numbers and the profitabilities and the market opportunities that's there. I think it can be done. Uh, you know, as I said at this conference I was at this morning, once again I heard a researcher say, "Well, farmers don't want to change." That is not true. That is not true, because if we didn't want to change, we'd be using a stick to put a seed in the ground. We wouldn't even be following a horse or an oxen or a small tractor. We have evolved over the last 150 years to where we're at because we embrace change. We're slow to change because we want to see the security and the ROI, and try to limit risk out of it. So something new like this that's out of the box, is kind of risky for people, because
Erin,
it's out of the comfort zone.
Erin, a question for you. I know you've done a lot of the studies on the cost of the program and the benefits, health benefits, and the medical savings, on that side, right? Have you done some work into what that translates to profitability for farmers participating in that kind of a system versus, more commodity agriculture, in order to put the numbers behind, like what Jimmy's saying, to show that path forward? Have you or anyone done some of that work there?
I've started thinking a lot about that, and we just did a recent survey with our farmers to see, what percentage of their market is being sold to FreshRx. Also, how much have they been able to stay the same as far as how much they're producing? Have they increased a little or dramatically increased? And we've seen a large percentage, about anywhere from 50 to 90% they're selling to us. They may sell the farmers market or have a CSA, and most of them have increased their production. And in fact, when we started this program, I was just buying anything they had available. And now we have a ton of overages because they have scaled so much. So I'm actually trying to keep up with them, which is a really beautiful problem to have, that we've stimulated that much economic growth. We haven't estimated exactly. We know how much we've spent on food, and we're reaching about, probably after the end of this year, about 500,000 of local food. And there's some research out there that says if you invest $1 into a community, that's like investing $3. And so that means with 500,000, we would have invested 1.5 million just on the cost of produce. And that's between about 20 growers that we work with. So we want to look deeper at some of that data and be able to communicate that better. But that's kind of the economic impact that we look at. And It's really just, we have tons of testimony, obviously, from the growers saying how they wouldn't have survived through the pandemic without us. It's been an incredible, they've gotten all this extra support, like getting funded for hoop houses through the resources we've connected them with. They've been able to increase production and also diversify their production and even get access to other markets through us. We've helped them get produce safety certificates. We're working on a group GAP certification, and we're getting them access to these resources, which means access to additional markets through working with us. So we kind of go above and beyond there. And we think that that would have a similar impact of other programs sourcing local, and hoping to be able to communicate that more. And so there's multiple ROIs to this work. And that's one way to change the minds, because it always comes down to the money. And there's a huge ROI in healthcare cost savings. And there's a huge ROI in economic development, because that $3 figure, the $1 that's really $3, goes into even like providing more jobs. So those farmers are hiring more people and paying them. So that goes into workforce development and economic development, and legislators love that stuff. So we try to communicate those pieces as well, and hoping to really hone in more on that data and be able to continually help people understand that we're using the same money to do this and being able to produce multiple ROIs. Now that is a solid investment.
So
So,
what are the,
Monty,
go ahead,
I want
Jimmy.
to tell you a story that we just done with my program, America's Conservation Ag Movement. We done a case study on a small farm in Shawnee, Oklahoma, uh, 40 acres, and they rent probably another 40. That has a mom and pop and two sons and their families, that's growing vegetables and fruit and all sorts of, and beef as well. They've been running now for about 15 years. They have two uh, storefronts, grocery stores, um, that employ another three families, and then they also have six migrant workers that live on the farm 9 months out of the year. So there's several more families, all living off of that 40 acres. And the family's doing very well. They have about 7 hoop houses, and then everything else is grown outside. That all goes to the two grocery stores. And what they can't raise, they outsource with an Amish community that helps package the rest of it up for the grocery stores. So as you can see, the profitability of what started at 40 acres has grown out a little bit more now, but not much. How many families that's supporting, that everybody's making a good living at. So it's very profitable what you can do, and the numbers are there, uh, but it's a lot of work. But agriculture's work, and so it's just perception of one job versus another.
So what are some of the wins that you guys are most proud of so far?
Well, it's seeing Aaron going from one doctor and one clinic and the first handful of patients to how many clinics now in Tulsa, Aaron?
22 primary care clinics across 6 health systems. So it's been crazy trying to keep up with that. And we've continually seen more and more positive health outcomes, reaching bigger records with that, both on A1C reduction and weight. I think the thing that is just blows me away the most recently, is before I even executed a pilot program for this in 2021, when I was like fundraising for it. And even before then, when we were just planning the program, because of how my mind kind of works, I knew that a grant funded program was not sustainable. And from the very beginning, like in my own mind, without really knowing what else was going on in the world, I knew that we needed to have health insurance pay. And I had gone on a farm just north of Oklahoma City, and I was kind of dreaming. And I was like, okay, so here's Aetna's section, and here's Humana's section, and here's United Healthcare or whatever. Um, and in only, just about 3 years later, I would say they're circling like vultures. And there's many states now, 15, that their state Medicaid is paying for these types of programs. And even seeing Hawaii pass a local procurement requirement in their state Medicaid. So state insurance is saying we're requiring organizations who are executing these food as medicine programs to source local. Um, it's really amazing that we're actually going to be submitting our first proposal to our first health payer this week, and it's surreal. Although I knew 3 years ago that this is where it needed to go, because that's the holy grail, is getting food as medicine recognized as a medical intervention and making it a permanent part of our healthcare infrastructure so that it's actually healthcare. And it's happening. And I think it's just a matter of time. It's not an if anymore. It's just when. And we're able to get prepared and are preparing for that. And it could be multiple health payers. And in Massachusetts, that have been doing this work for over 5 years as a part of their Medicaid, many of these food as medicine programs are contracted with several health payers. And I think we're going to see this federalized in the next 5 years. And of course, everybody wants a piece of it. Of course, there's programs that say their food is medicine and giving out ultra processed foods. And so there does need to be standards for the work, and we're hopeful to help kind of set some standards, especially with the sourcing with regenerative ag. But I think me saying we're proposing to a health payer this week, that is surreal. That's a dream that is absolutely becoming reality.
Well, you see, Monty, that where we come from square zero where she's at right now, and then she's expanding into Oklahoma City. We got several different states that's wanting to try to figure out how to grow the program from here to there. Um, and we're helping lots of energized local small communities and farmers that need the help desperately too. And when you see these come together, and if you were growing the food, Monty, that was making me healthy, when you and I meet, that is powerful. That is really powerful. And then you have the doctor saying, yes, it's because this guy grew this and you ate this is the result of you being healthy now. Uh, it, that's all I need, Monty. That's all I need.
Well, I'll send you some steaks, Jimmy, if that'll help. I'm just joking. No, when you look at this, okay, so first off, insurance companies don't pay more than what they have to, period. Okay, now Medicaid by state, that could be politically motivated and those kind of things. But when you're talking United Healthcare, Aetna, these large insurance payers, they've run the numbers, right? And they know that it's cheaper to have food as medicine than insulin, in perpetuity. So
Yes.
that's the first step, right? So then that gets you to where now we're getting produce from Salinas, Yuma, and Florida. Wherever the cheap. We're just looking for like fresh produce, right? Fresh food. That's there's no other bar, right? So how do we get them to get local produce? How do you make that next step? How do we get the mathematical actuarial nerd types involved in that to get to the
Right.
local part, right? And then another part is how do we get them to take that from just standard conventional produce to the regenerative part? How do you get it all the way? I mean, those are huge steps to make, right?
Right.
And
Right.
and I love that the food as medicine is, if they're spending money, right? That part's been done, right? So how do we get them to better food as medicine to best food as medicine?
I think it's going to be some of these studies that are going to be happening, now and in the near future, especially with Dr. Stephen Chin and myself and a couple others. to get that data and the ROI and to prove that maybe it's expediting health outcomes to source that way. The particular health payer that I'm kind of mentioning this week, I told them when I first met with them, and this was over a year ago, I said, I know that you could get a health benefit on your plan for like $500 a year per person, but that's not really a health intervention. We might be a lot more expensive than that. And how would you feel about that? Because that's a complaint I get all the time, is that we spend so much money on the produce and on aggregating the produce. And then we're also doing a lot more education, patient monitoring, and empowerment. Well, they said, if you're going to produce the outcomes that you're producing, we want to pay for it. And that was their response. And that gave me a lot of hope. So I think further proving the added benefits to not only local sourcing, but regeneratively sourcing is going to be vital. I think we're going to see added benefit to it beyond just health outcomes and ROI. I think we're going to see that people are more compliant in the programs because the food tastes better. And so I think that we're going to see a lot of these types of added benefits that the health payers will really care about with all this new research. And I think there's the big question on nutrient density. And obviously, there's all these different definitions of nutrient density. I heard a really good one recently talking about how we really need to reframe what nutrients we're talking about. Like there's nutrients that, if you think about a car analogy, he said, there's fuel we need just to run the car, and then there's different elements to optimize how the car is running. And I really like that differentiation. There's all these layers of nutrient density and arguments on, do they relate to health outcomes? Would that relate to an A1C reduction? I don't know. But I think as we dive deeper in nutrient density studies, which are so many going on now, trying to follow them all, that will also help me prove that, say, hey, okay, health payer, you could contract with any other food as medicine program you want. That's the generic prescription. If you want like the real valuable one, then you're going to come to me and I'm going to have the data to prove that you may have to spend a tiny bit more money, but your healthcare cost savings is going to be larger. So I think it's advocacy, making sure that there's legal language when states are passing these food benefits, that it's explicitly spelled out. And what Dr. Chin often says is, maybe we don't want to like cast people out for not sourcing local or sourcing regenerative. Like food as medicine is still really important if you're going from McDonald's to fruits and vegetables. Like even conventional fruits and vegetables will be beneficial. But what if we had a North Star? And that's kind of how he puts it, at least a North Star, or prioritizing when we can local and then regenerative as well. And so it's making sure there's legal language when you're advocating for those things, and making sure that's, you have a seat at those tables when those decisions are being made and you're speaking up about that. So I think some of the research, the policy stuff will drive that, and health payers will start to see that there are a difference between programs like Dr. Chin and mine and others.
Very, very good.
So, Monty, there's something else that she didn't mention. When her and Dr. Farish first started, he wanted to source through Amazon to bring the food in, and she was very steadfast in saying, "No, we need to grow this locally to provide jobs and opportunities for this community." But it's so much better, and it's nutrient dense. And guess what? Now Dr. Ferris grows his own in his own backyard and garden. So that's how this has evolved. And there's just lots of steps that these doctors and clinics and growers and producers and medical care insurance companies all have to learn together. And that's how we're going to do it. It's grow together. It's gathering the data. It's showing the benefit. It's the doctors seeing the change and the difference from shipping in from Salinas to picking it up 6 miles from the source to the patient, and seeing the difference in that. And that's that evolving growth is how we're going to get this done.
Couldn't agree with you more. And I think it's just fascinating how fast this is happening when you look at what you have involved, right? Farming, typically not a high change culture. Okay. Medicine, typically not a fast paced change culture. Bureaucrats, typically not a fast paced change culture. But you look at how this has come in from the fringe in just the last 3 to 5 years. And I think it has a lot to do with our better understanding of microbiology and its connection to the human health. So, um, paint us a picture, Erin. 5 years from now, lots happened in the last 5 years. 5 years from now, what's it going to look like? We're going to have nationwide prescriptions available for everybody, and all food's going to be regeneratively raised, and we're going to live to 150 years and look like we're 30 years old. Is that what we're going to do?
I will paint a beautiful picture for you.
It'll
I
be
think
better than what I just said, that's for sure.
yours is pretty good, but I have a vision of health insurance, contracting, and really investing in local communities and really seeing social determinants of health, anything that's outside of clinical care, as more important than even clinical care in so many ways. Because, for example, 80% of health outcomes actually have to do with things that happen outside of the clinic. And food, transportation, and housing are basically most of that. And so I'm really starting to see the shift already to health payers investing more in that and more in prevention. But what would be really revolutionary is if the organizations actually doing that work, actually providing the food, the transportation, the housing, that they're actually the ones producing these health outcomes and that they benefit from that. They don't just get paid a price per month per patient to do the work and then the health payer reaps all the benefit from the healthcare cost savings, that these communities reap the benefit of producing their own health outcomes for their communities, and the farmers should also benefit from that. And so the financial incentive should be completely shifted to where farmers are paid as pharmacists as a part of this financial model. And that will create the investment to really spiral this in the direction that it needs to go. And so I really see every health payer in the nation investing directly into communities and social service agencies doing this work, that know this work, that already do this work and connect with community, and directly to these farmers, and that there is a easy pathway and aggregation point across the nation in small areas of little hubs and food distribution systems that are built with equity for farmers, that are built for equity for health and for people from all walks of life to be able to access food, and that it's just a part of our community for people to have access to this and for people to be reversing chronic disease at a rapid pace.
That one's a hard one to follow up, Jimmy. What do you see in 5 years?
You can add to it, Jimmy.
I love how you think, Erin. I really do. You're not afraid to think big, and that is awesome. I really appreciate that.
Well, I think we're going to see a huge growth in urban agriculture, and I think as ag starts to separate a little bit here, because equipment is getting so expensive. It takes $1 million just to buy a piece of equipment anymore. The bigger conventional guys they're going to have to take off on that area. That means that the medium sized, the smaller guys have got to diversify and try to find more revenue. And I think this opens that door for them. And so I think there's a lots of opportunity in the next 3 to 5 years to have ag more prevalent in urban areas, where we have been shoving the ag out of urban areas and gobbling land up. And now what's behind is opportunity in them lots and spaces in them urban areas that can grow food locally and really help them communities start reviving from inside out instead of growing out and grow the inside. So I have a big vision too on the ag side of what we can do that complements what Erin's doing, and that's the reason the team here works so well. we have a common vision of we want everybody to do better. And her expertise in the medical field and connections and my connections in the ag field and the soil side of that really makes a great partnership to how we grow this. So as you can see how far she's come since 2021, where we're at now, it can only grow at a greater rate going forward with the work that we're doing all abroad. So I think in the next 3 years, you're going to see a dynamic change in the way this looks across the country.
Pretty incredible. We're going to have to add some things to your typical phrase that you end it with, Jimmy. But we're going to have to say, long live healthy individuals, long live dynamic communities, and long live our ecosystems. But also, you say it best, sir. Long live
the soil. Our lives depend on it.
It's all connected.
The time is now.
That is true. And again, Erin, all the hard work that you've poured into this, and it's great to see the traction coming with the 22 clinics you're working with. That definitely, you're creating the pull through, and farmers were ingenious, and we'll happily supply what you need. So,
yeah, the farmers are the longevity heroes.
It's good to know. It's good to know. Anything else we should add before we part today, folks?
Well, if you want to learn more about us, go to www.freshrxok.org. We're also on TikTok at Food as Medicine. And if you want to learn more about me, I'll have a new website up probably in about 30 days. So if you're watching this later, it'll be www.erinwmartin.com.
Very good.
And if you want to see some of them case studies that I'm working on, these small growers across the country, go to americasconservationagmovement.com and you can see them videos there.
Great. You gave everybody homework. That's awesome. I love it. Thank you both so much for taking time to be here today. And I hope that a lot of people hear and have hope of what is possible with agriculture and our food system, because you really are changing lives, and looking forward to the long-term impact.
Thank you.
Thank you, Mike.
Thank you.
What a great discussion. We hope you're feeling as inspired as we are by the incredible work of Jimmy and Erin. Their commitment to regenerating our soils, transforming our food systems, and enhancing human health is proof that real change is possible. We sure appreciate you tuning in, and remember, each of us does have a role to play in creating a healthier, more sustainable future. So if you'd like to learn more about what we're doing to help growers adopt effective soil health practices, then check out our website at asn.farm, and there you can click on links to follow us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. There is a lot of great things happening and always something to learn. Thanks for listening.